Assalamualaikum warahmatullahi wabarakatuh. I would like to say thank you for coming to my presentation. It's great to see you all. Before I introduce myself, I would like to say thank you to my intermediate listening and speaking lecturer, Sir Dr. Aprianto M.E.D., because it was thanks to the learning that I was able to present my material. Let me introduce myself. My name is Aisyah C, and I'm come from Paket University of Riau, with my name is 2005-11-31-55. Okay, in this presentation, I would like to explain about vaccination for COVID-19. Protect yourself, protect the country. We know that we are currently in a pandemic caused by a dangerous and contagious virus. The first question that is in the minds of all of us must be about how we get out of this pandemic. There are actually 3 steps so that we can get out of this pandemic. Namely, first is 3M. Transmission has stopped with the implementation of health protocol. A whole community remains whole, is not affected, is not sick, can be active, work, study, be productive. Second, vaccination for COVID-19. Promote group immunity with high COVID-19 vaccination coverage at least 60%. Transmission does not occur because most people have good immunity. Healthy people remain healthy, including those who cannot get vaccinated because of age and impaired immunity. Third and last, we have third T. What is infected is no third test. Those in contact with those infected were traced and quarantined. The infected undergo self-isolation. Those who are symptomatic and sick get treatment and medication to get healthy again. COVID-19 vaccination is an important part of the comprehensive and integrated handling of the COVID-19 pandemic, covering aspects of prevention by implementing health protocol, maintaining distance, washing hands with soap, and wearing masks. COVID-19 vaccination and 3T, tes, telusur, tindak lanjut. Next, we have survey about of public perception about COVID-19 vaccination. This survey is from data in Ministry of Health, ITAGE, WHO, and UNICEF. The result of the vaccine acceptance survey conducted by the Ministry of Health together with ITAGE, Indonesian Technical Advisory Group on Immunization, with the support of UNICEF and WHO in September 2020, showed that most people, 74%, already knew about the government's plan to implement the COVID-19 vaccination. As many as 16.5% are willing to be vaccinated, about 27% are still in doubt, and only a small proportion, or about 8%, stated that they refused because they were concerned about the safety, effectiveness, and halal of the vaccine. The survey results also show that those who have information about the COVID-19 vaccination are more likely to receive the COVID-19 vaccination. This shows the importance of ensuring that all people have access to accurate information about handling COVID-19, including about COVID-19 vaccination. In Indonesia, COVID-19 has COVID-19 has data like this. This is confirmed about COVID, and this is active case. And this is recover of COVID, and this is a data of people died because of COVID. This data is from COVID-19.go.id, and the last update is 16th December 2020. Next, we have what is COVID-19? COVID-19 coronavirus disease 2019, herein after referred to as COVID-19, is an infectious disease caused by several acute respiratory syndrome coronavirus 2 or SARS-CoV-2. How long does it take for COVID-19 symptoms to appear after exposure? In general, symptoms begin around 5 to 6 days after exposure, but the timing of the symptoms can range from 1 until 14 days. Basic information about Basic information about immunization and vaccination. Vaccination is the provision of a vaccine that is specifically given in order to raise or increase a person's active immunity to a disease, so that if one day exposed to disease, it will not hurt or just experience mild illness and not a sort of infection. And what is immunity? Immunization is what is immunization? Immunization is an effort to build a person's immune system against a disease that if one day they are exposed to the same disease, they will not get sick or only experience minor illness. And what the function of immunization? The formation of human immunity against infectious disease can be actively done naturally without suffering directly from the disease or artificially through immunization. This is how we can make human immunity. Are there any post-vaccination reaction? In general, the post-vaccination reaction that arise can vary, are generally mild and temporary, and do not always exist, and depend on the condition of the body. Mild post-vaccination reactions is a fever and muscle aches or a rest at the injection site are normal, but still need to be monitored. The benefit of the vaccine far outweigh the risk of getting sick from being infected if not vaccinated. How effective will the COVID-19 vaccine protect? The protect effect of the vaccine for the Sinovac vaccine clinical trial in Bandung is still awaiting a full report. However, to date, based on the result of phase I and II clinical trial, the available vaccine have been shown to be safe and increase immunity against COVID-19. The protection that will be given by the COVID-19 vaccine in the future needs to be followed by compliance with 3M health protocol, wearing masks properly, keeping your distance and away from crowd, and washing your hands with soap. Vaccination for COVID-19. When is the COVID-19 vaccination done? Period 1 is January until April 2021. Period 2 is April 2021 until March 2022. Total time is 15 months. And who and how much will be vaccinated? Period 1, 1.3 million health workers, 70.4 million public officials. Period 2, the general public complies with definite criteria. Total recipients up to March 2022 is 181.5 million people. Total needs for vaccine 181.5 million people. Health worker and public service will receive first priority vaccination. Wave 1 period vaccination period January until April 2021. The first is health officer spread over 34 provinces, and second is public officer. Next is elder. Wave 2 period vaccination period April 2021 until March 2022. Third is vulnerable people in area with a high risk of transmission. Fourth is of other communities according to the availability of the vaccine. Note that vaccination in the early stage is carried out for health workers and continued with people 18 until 59 years. 60 years and over will be vaccinated after receiving vaccine safety information for that age group. I think that's my presentation. I'm sorry if I made many mistakes about my presentation. And thank you for your listening. May all those I have shared be beneficial for all of us. I close with wassalamualaikum warahmatullahi wabarakatuh.